Hi everyone, Dr. Suneel, Dhand, medical doctor. Welcome to another video. Well, what is going on here? Why have I got my stethoscope on? Well, I have finished a busy day in the hospital and it's somewhat cold even in the hospital. So I usually wear a shirt, tie, white coat, but today this is what I was wearing during the day. And I've literally sat in my car just now and I want to make this quick video because there's a very important point that I would like to impart regarding blood pressure control and the absolute tragedy of over-treating blood pressure. Now, I've made videos on this before and I find it utterly horrible that there are so many people out there, predominantly in the older age group, the over 65s, who are way over-treated for blood pressure. So I'm going to present to you in this video what the problem is, what some of the symptoms are, and how you can go about lowering your blood pressure medications if this applies to you or a loved one. Now, of course, this goes without saying, never change any medication yourself. Always speak to your doctor, but I'm going to present a framework to you by which you can have this discussion with your doctor if you're being over-treated for blood pressure. Millions and millions of people out there, of course, are on blood pressure pills. And it isn't talked about anywhere nearly enough, but the vast majority of people with hypertension have underlying insulin resistance. This is also linked to other problems like pre-diabetes, type 2 diabetes, high cholesterol, but we don't talk about this enough. We are a pill-pushing culture. And a very common scenario is that somebody maybe in their 40s or 50s might get put on a blood pressure pill. Then before they know it, they will be put on another blood pressure pill, then another one. And I can't tell you the number of times in the hospital I will see a patient who is on 3, 4, 5 blood pressure pills. And then we will check their blood pressure. And obviously it tends to be on the lower side when somebody is sick. But then they will tell me their history. And I suspect that they've been way over-treated for blood pressure for a while. And it is so very sad, and it invariably will lead to a lot of problems eventually. So what are some symptoms of low blood pressure? If you're on blood pressure pills, some symptoms of low blood pressure could be that you feel weak, you feel dizzy, you feel lightheaded, especially when you stand up. You don't quite feel right. A lot of people will generally just feel very sick if they're running at a low blood pressure. So what would be a low blood pressure? Well, we probably all know, or at least I hope most of you know, that the quote-unquote ideal blood pressure, if there is such a thing, 120/80. 120 is the top number, that's the systolic number, and 80 is the diastolic number. So that is seen across the medical world as the gold standard. You want your blood pressure to be as close to that as possible. I actually think that we can be a lot more conservative. I wouldn't say we want it to go up to the 150s, 160s, but I think 130s, 140s, especially in the older age group where you want enough blood perfusion to the brain, is not necessarily a bad thing. But of course we know that the current medical paradigm is to treat numbers and be as aggressive as possible. Meanwhile, the medical industrial complex and big pharma makes a ton of money. So we right now have millions and millions of people out there who are probably walking around feeling a little bit weak, dizzy, lightheaded because they're running at a low blood pressure. So the top number could be in the low 110s, it might be in the hundreds, it might even be in the 90s. I kid you not, I really believe that this is going on a mass scale. So how do you know if you have low blood pressure? If you're on a few blood pressure pills, how could you know if you're being way over-treated? Well, here is what I would suggest. Get a blood pressure machine. These are usually available. Most of you, I'm sure, probably already have a blood pressure machine, but make sure that it's not too old and make sure that it's accurate as well. So I'd suggest next time you go to your doctor's office or even to a pharmacy, measure the blood pressure using your own device and then the professional device, and make sure that the two correlate with each other. Hopefully you get what I'm talking about. Logically, you want your blood pressure machine to be showing the same reading as a professional blood pressure machine at the same time. So here's what you're going to do, or tell a loved one to do. I want you to document your blood pressure 3 times a day. Morning, afternoon, evening. Now, the morning measurement could be before your blood pressure pills or maybe an hour or so after your blood pressure pills. Probably better to do it after your blood pressure pills. So morning, afternoon, and evening. And I want you to write these down in a diary. do it for 2 weeks and watch what your blood pressure readings are showing. And the question is, are they consistently in the low 110s or even in the 100s? You may be surprised. Sometimes it might be even lower. Of course, it's possible that maybe you're running at a higher blood pressure and this doesn't apply to you. This video is specifically for I suspect, millions of people out there who are being overtreated. You can also do this as well. This is a good idea. Measure your orthostatic blood pressure. This means measure your blood pressure lying down. Then you want to sit up, wait for a minute and check your blood pressure. And then you want to stand up and wait again for 30 seconds or 1 minute and check your blood pressure and see whether there is a significant drop. That is what we call orthostatic hypotension. So your blood pressure drops when you stand up. Your pulse will also tend to go up when you stand up if you are significantly orthostatic. So note all of these measurements down. And then I would like you to go to your doctor. Remember, it's never a good idea to lower your blood pressure medications or change any medications yourself. You definitely shouldn't do that. You want to do this under professional guidance. So if you're checking your blood pressure and you notice that consistently it's in the low 110s or 100s and you're on blood pressure pills, it is a high possibility that you're being overtreated for blood pressure, especially over the age of 65, where there is a large school of thought that I actually subscribe to, that you will be getting less blood to the brain, and that will not only make you dizzy, weak, and prone to falling, but also more prone to cognitive impairment, which is definitely not something anyone wants. So if you're getting these consistently low blood pressure readings, talk to your doctor and say, look, I'm on these blood pressure pills. Maybe you're on 2-3 pills. Is there room for maneuver? And hopefully if you have a good doctor who understands that you definitely don't want to overtreat blood pressure, they will gradually lower your blood pressure pills. What I tend to do is I tend to taper them off slowly. And I can't tell you the number of people out there that I've managed to do this with who have realized that they haven't been their best because they've been running at a low blood pressure. They have been victims of the medical industrial complex over-treating people and then leading to lots of problems. So again, I will tell you, on an almost daily basis when I work in the hospital, I see people who have likely been way overtreated for blood pressure and their blood pressures have dropped down too much, and it is making them prone to a lot of complications. At worst, it could even mean collapsing, losing consciousness, or even worse. And 2 further things to bear in mind. I've touched on one of these already. If anybody is getting sick, even with a respiratory tract infection, it's likely that their blood pressure will start to drop. And if you keep on taking your regular blood pressure medicines, that could make things worse. And the other very important thing to remember is that as a lot of people age, this tends to happen after the age of 70, the blood vessels around the heart can calcify, and it can be normal to have a higher blood pressure. I really think this is a horrible paradigm that we have in medicine and healthcare, that we have to treat a number and we're hyper aggressive with many people that we shouldn't be aggressive with. I will say once more, we don't want the blood pressure to be too high. I wouldn't recommend that consistently the top number is above the 150s or 160s, but even that, there is evidence that when people get to extremes of age, even a blood pressure in the 150s or 160s isn't necessarily a bad thing. I'm talking about people in their late 80s or 90s, but again, that is a judgment call based on other risk factors as well. So I hope you found that video helpful. I wanted to make that video. I'm very passionate about this issue because so many people out there are suffering due to over-treatment. Thanks everyone for watching. Dr. Suneel Dhand. Feel free to leave a comment down below. Have you been a quote-unquote victim of over-treatment of blood pressure, or do you have a loved one that this has happened to? Feel free to comment down below. This is all about trying to be as healthy as possible and recognizing that many of the things that the medical industrial complex does end up not necessarily being good for the population because they haven't been thought through at all. Take care, everyone. Check the links in the description down below for my website, my natural supplement, and all the other work I do. Hit the like button if you like this video and the subscribe button for more similar videos in the future. We will speak again very soon.